Hello. I prepared a video to give a quick overview of my practicum. Our program content gave me the idea to ask my family and community if they'd like to participate in the video. And the process of making it ended up feeling like a community building activity in itself. Quickly, I'd like to thank, I'm so nervous. I'd like to thank my practicum supervisor and the team that I worked with during my practicum, and the faculty here at UVic, and very importantly, my fellow students.
You might want to press the play button.
Welcome to my practicum taking place at a health center run by a First Nation. I was looking forward to having a change in routine and understanding how our studies apply to the work setting. However, I was also very nervous about many aspects of the practicum as I was an outsider to the community. As it turned out, my supervisor was very friendly and very knowledgeable and willing to share in every aspect of the work being conducted at the organization. And it wasn't all work, we had a lot of fun. My focus was on an integrated case management system that was in the initial stages of development. This is where services collaborate in order to provide clients with the best, most holistic care possible. This can also be known as a shared care pathway. But there were some problems, as in some power struggles. Learning about the challenges and understanding the complexities took a lot of time. Assets and capabilities were moving the process forward, and these included a strong organizational mission, a consensus within the community, and cultural values. However, an elder in the community taught me about the most important enabler of change, acceptance. He shared with me that everything is always changing, and when we refrain from judging what we see as either good or bad, we allow positive change to happen naturally. We are all capable of positive change, young or old. Acceptance in the moment of how things are is key. But there were also barriers, which were political in nature and working to pull the development of an integrated case management system off track. I learned about the politics involving individuals, the history of the organization, and the politics involving the system. I understood the first course of action was to build on the enablers, which were the assets and capabilities in the community. Through formal and informal meetings, the health director and my supervisor role modeled self-care and positive relationships and acknowledged people's strengths. They also spoke of the values of local culture and important traditions. This worked to overcome many of the barriers on the individual level in the short 3 months I was at the health center. I was fortunate to participate in the strategic planning, which served to shift the programs and services to focus more on cultural values. Where politics still present challenges on the organizational and system levels. Creating buy-in from every department and every service will take much more time, and the jurisdictional gaps and colonial views persist as challenges. Building an integrated case management system that focuses on the client and is culturally relevant and safe requires persistence and vision. I learned so much about the importance of self-reflection and cultural competence. I believe the work at the health center is taking a great big step towards social justice.
So as you know, we're still in the process of building the, no, you can't escape quite yet, of building our BA program. And so I've already added Marla's children to our recruitment list. I know they're a little young, but I look forward to seeing them on stage in a few years. So does anyone have questions for Marla? Michael's going to be distributing the microphone.
Back to Phil Donahue.
No? Okay. Thank you all.